Hello, everybody. Dr. Puya here. In the last video, I talked about GLP-1 receptor agonists, specifically semaglutide, brand name Wegovy, and tirzepatide, brand name Zepbound, and their mechanism of action and utilization in treatment of obesity. In this video, I would like to talk about another category of drugs, sympathomimetics, such as phentermine, phendimetrazine, and dietopropion, and their mechanism of action. These drugs have been around for many years and they are in generic form. We don't really use the brand names Adipex and Tenuate as much. And they are very cost effective, and most pharmacies have them. They are sympathomimetics, meaning they increase the sympathetic nervous system, the stimulating nervous system. And that's the mechanism for appetite suppression and also increases the metabolism. The generic forms are only used for short-term treatment of obesity, up to 3 months, but they have done research for people that have been on them for a longer period of time, and they've seen that they're quite effective and for weight loss and weight maintenance. However, that would be off-label use. There is a brand name of the phentermine called Qsymia, which is a mixture of phentermine and topiramate. Topiramate is an anti-seizure and migraine prophylaxis drug. And Qsymia is approved for longer term treatment of obesity. However, it is quite costly, but some doctors separate them and prescribe phentermine by itself and topiramate by itself. But then again, that would apply that it would be only used for or approved for short term treatment. These stimulants are controlled substances, so they require hard copy prescription and also or two-factor authentication if your doctor is sending it directly to the pharmacy electronically, and they do get reported to the Drug Enforcement Agency. So for some employers, if you're getting a urine drug test, they might show because they're stimulants. They are contraindicated if someone has high blood pressure, heart disease, panic attacks, manic episodes, and arrhythmias. Typically, I run an EKG on everyone to make sure they don't have an arrhythmia, and I usually avoid prescribing them as a first-line agent for treatment of obesity unless someone has been on a diet and behavioral modification, and also if someone has in the elderly advanced age, just because the risk of heart disease goes up and we don't really want to increase that or add to that. But they are cost effective and for most people well tolerated. But if you want this prescribed, you have to make sure you're seeing an obesity specialist who's familiar with it, familiar with the dosing, and also check if you're on other drugs to check it against other drugs because they can interact with other antidepressants, blood pressure medications, antipsychotics, and whatnot. So if you have any questions, you can post them in the comments. Otherwise, I will talk about other categories of weight loss drugs in subsequent videos. Okay, thank you for watching, subscribe, and learn. Until the next video, have a good one.